The Catholic University of Korea Seoul St. Mary's Hospital, which promotes patient-prioritized whole-person care with respect for life, developed an artificial intelligence (AI) solution for analysis, diagnosis, and prognosis prediction of prostate cancer, along with the top 4 hospitals in South Korea, including Seoul National University Bundang Hospital, Samsung Medical Center, Seoul Asan Medical Center, and Konkuk University Medical Center, and 3 companies that are leaders in software development in AI for precision medicine. Based on the medical data, 닥터앤서 can answer any question and will assist physicians in patient care. Now, a new era is beginning for the diagnosis and treatment of prostate cancer, optimized specifically for the Koreans. 닥터앤서 leads to a bright future for treating prostate cancer. While modern medicine's paradigm is shifting focus from post-treatment to prevention, Korean AI 닥터앤서's prostate cancer program, by collecting data from 10,000 prostate cancer patients at 4 major hospitals in Korea, predicts the area of cancer occurrence and prognosis in clinical, radiological, and pathological fields, and provides faster and more accurate future precision medicine service for both medical staff and patients. 닥터앤서 can interpret magnetic resonance imaging, MRI images, of more than 1,300 cuts per patient in a few seconds, which generally takes more than 30 minutes for a human physician. It can also detect the area of possible cancer occurrence, something that can be difficult to locate or is missed easily by a physician. 닥터앤서 compares and analyzes the new patient's data to existing data to predict the results and provide treatment guidelines based on which the patient may proceed to undergo treatment even in primary, secondary hospitals lacking specialist physicians. Hello, this is Ji-Yo Lee, the head of the Smart Hospital of Seoul St. Mary's Hospital. Prostate cancer is difficult to diagnose and treatment decisions are complicated. Ultrasound and CT imaging do not detect prostate cancer, and if the male prostate level, called PSA, rises to 3 or more, an MRI is taken and a biopsy is performed. Even if a doctor who specializes in radiology and prostate reads MRI images, the accuracy of prostate cancer reading is about 80%. Prostate biopsy also takes a long time to read 12 or more tissues. It is difficult to make treatment decisions because different pathologists can have different diagnosis of malignancies in prostate cancer tissues. Promise Clip of 닥터앤서, an artificial intelligence software for prostate cancer, not only automatically reads pathological biopsy and MRI imaging tests, but also it is an artificial intelligence software that can predict prostate cancer stage and predict prognosis by entering your PSA value and pathologic findings. 닥터앤서 Prostate Cancer Program is a software based on clinical data of Koreans. When a new patient's clinical data is entered, it compares the new data to the existing data and produces a report on prediction of prostate cancer staging and proper management of outcomes. 닥터앤서 provides the information in a suitable format to both the medical staff and the patient, identifies areas of possible prostate cancer, determines the cancer risk by performing a rapid medical image analysis, and detects cancer by analyzing the uploaded pathology slide files within 30 seconds. It is an efficient and smart program, something that is imperative in the field of medicine. 1. Log in by entering your email address and password. 2. Upload the slide files. 3. The uploaded image can be rotated and zoomed in and out. 4. When you click on Analyze the image, the analysis begins. 5. When the analysis is complete, 닥터앤서 gives you the answer at the slide level about whether it is classified as cancer or benign. Also, the area identified as cancer will be shown. 6. By using the Measure Length tool, you may measure the length of the area of interest. Using 닥터앤서 Prostate Cancer Program will change the process as follows. A patient with urinary symptoms, such as residual sensation, realizes his problem after receiving the tissue biopsy. Following this, he is diagnosed with prostate cancer with clinical staging through imaging. However, he is shocked and gets confused by the complex medical terms used by a doctor. Although he has some understanding of his condition, he completely depends on his doctor when deciding the treatment. The patient does not perceive his condition accurately during or after the treatment. Furthermore, he does not know exactly what he should do in the future. However, using the 닥터앤서 Prostate Cancer Program gives him the predicted staging result from the software as soon as he detects this problem at the hospital visit and explains to him the future therapeutic plan based on the National Comprehensive Cancer Network (NCCN) guidelines. Thus, the patient can improve his understanding of the medical condition and may be able to discuss with the doctor regarding the therapeutic plan. Then, the patient can go home with a printed result of his predicted staging given from the hospital, share the result with his family, and receive the treatment according to the therapeutic plan based on the prediction results. In addition, after undergoing surgery, the patient may get information about both the staging predicted formerly and the final staging after the surgery, thus building more trust in the therapeutic plan and the result. In the future, 닥터앤서 will develop beyond the prediction of the prostate cancer staging and prognosis to the provision of optimal treatment decisions and prescriptions for medication, and will evolve into a software for all, including the medical staff supporting the patient's decisions along with the patients themselves.